Psychotherapy is the primary first-line treatment for PTS, and there have been various denominations emerge. According to the evidence-based approach, the recommended psychotherapies for PTS include prolonged exposure therapy, psychoeducation, cognitive behavioural therapy, and Emdr. The mainstay of psychotherapy for PTS is prolonged exposure therapy with response modification. This is particularly important for those who may have never spoken about the traumatic events they experienced or whose military service is quite recent. Although clinical evidence supports prolonged exposure therapy, there are members of the veteran community that do not regard this therapy as beneficial or helpful. I welcome your feedback on your experiences with prolonged exposure therapy, both if you are a veteran or if you are a civilian. The second most important psychotherapy used to treat post-traumatic stress is supportive therapy and extensive psychoeducation. This includes the close follow-up and education of veterans about the many aspects of post-traumatic stress and how to overcome those causing impairment or concern. Substance abuse is extremely common in people diagnosed with PTSD, and people presenting with psychiatric symptoms should be asked about their substance use, both legal and illicit. Veterans with substance abuse need to detox before they can participate in any psychotherapies. The combination of the two conditions is called dual diagnosis and often requires more specialised care than if either condition occurred on its own. Cognitive behavioural therapy, or CBT, is a type of counselling. The whole basis of CBT is that your thoughts lead to feelings rather than the feelings just occurring out of nowhere. The theory behind CBT is that feelings can be moderated by changing the thinking that created them. The emphasis of CBT is identifying negative and irrational thoughts and teaching the veteran to refuse and substitute those thoughts with more positive and rational ones. As a result, the veteran's feelings are less negative, irrational, and potentially destructive. Another therapy that is available is Emdr, which stands for Eye Movement Desensitization and Reprocessing. As the name suggests, Emdr involves revisiting traumatic memories whilst conducting rhythmic eye movements. There is contention about how Emdr works. However, it is theorized that Emdr appears to be similar to the natural eye movements that occur during dreaming and REM sleep, and therefore better facilitates the processing of traumatic memories. There are several PTS centres that operate a course, usually on an outpatient basis. These courses combine a mixture of psychotherapies that are delivered in a group setting.
It explained what PTSD was, how it worked within the mind and the body and all that sort of stuff. And it was absolutely eye-opening. I will never stop having my bad dreams or my flashbacks, but now I know why I'm actually having them. It was an incredible course. The people there who I met will be friends for life.
However, the delivery of essential health education is not something that sufferers should have to wait for. In Stephen's case, he waited some 44 years. People should not have to wait till they are hospitalised. They should not have to wait till they are on a course. The technology and evidence is available so that people can access health education that they need. And this series is a small but necessary step to improvement.